Causes, symptoms, and the treatment of schizophrenia. Watch this video very carefully and try to understand everything. Schizophrenia is a complex and chronic mental disorder. There is no consistency in thoughts and feelings of the affected patient. The patient loses feelings or appreciations of reality. Often suffering from hallucinations, individuals with this disorder experience social or work-related disabilities. Symptoms of schizophrenia. In most cases, the symptoms of schizophrenia are hallucinations, misconceptions, unrealistic thoughts, unnecessary doubts, confusion, irony. Not all patients with schizophrenia have the same symptoms. Symptoms vary depending on the patient. In some patients, the symptoms of this disease may develop slowly or suddenly for months or years. So, some of the symptoms of this disease are: the patient hears or sees something that does not exist. Strange or irrational way of talking or writing behavior. Feeling indifferent to important situations. Strange changes in study or different tasks. All of these patients are almost isolated from the real world. From the very beginning of some talk, there is a sense of normalcy and devotion. Normal people who have hallucinations and delusions are uncommon and, in some cases, insane. In some cases, the extraordinary knowledge of the patient surprised the people in this house. The negative symptoms of schizophrenia are delusion. People with it usually carry misconceptions or beliefs which have no resemblance to the reality. For example, someone is plotting against him. Hallucinations. To see, feel, taste, hear or smell something that does not exist, people affected by it feel unrealistic. Disturbing thoughts and conversation. In this case, the patient goes from one subject to another very suddenly. Patients may repeat a word or rhyme repeatedly. Disorderly behavior. In this case, there is a problem with healthy behavior in the patient. For example, changing thoughts quickly, forgetting, not making any decisions, repeating different gesture, not understanding words or feelings, etc. And now, causes of schizophrenia. The exact cause of this disease is not known. However, the factors that are responsible for this disease are: the genetic or hereditary disease can also occur in the next generation. Parents, mothers, and children have a higher chance to becoming infected. The infection is likely to be caused by viral infections, psychologically stressful situations, etc. The disease occurs if there is a defect in the chemical element in the brain and any deficiency in the nutrient-chemical components. There is a possibility of the disease even if there is a birth defect. If a mother is infected with a virus during pregnancy, the disease can occur. Some stimulant drugs are the cause of this disease. And finally, treatment for this disease. If symptoms of the disease appear, consult a doctor or specialist. The main mode of treatment is antipsychotic medication. It helps reduce various symptoms. Besides, various therapies and psychotherapy are also important. Various symptoms can be cured by various psychiatric treatments, and the patient needs social support. This is very important. Besides, the patient can also have an electrode placed on his head with anesthesia and given a small current shock. It also improves the patient's mental state and thinking.